Hey, it's Dr. Zeeshan Abbas again at Westmount, and I'd like to talk you guys through a case that I did recently that I'm really proud of. So this really funny, energetic, bubbly, lovely person came to see me because she suffered some trauma to her front tooth when she was a kid, and then she had to have a root canal, a crown on that tooth, but eventually that tooth became unrestorable, so unfortunately she had to have the tooth extracted. Now when she had the tooth extracted, in order to replace the gap, and it was a front tooth, keep in mind, she had to have a denture made. Now that denture kept breaking, and I think by the time she came to see me, she was actually onto her third denture, and she named the dentures John the First, John the Second, and what I had to deal with was John the Third. As always, we did a full, thorough and complete consultation. Through the consultation, we found that she did have some crowding, but she wasn't bothered about that. She did have some discoloration of her teeth, and she definitely wanted the colour improving, and she wanted some whitening treatment. And lastly, she wanted a better option than the denture for her missing tooth. So in this case, we decided that a single implant would be the best option going forward, so that the teeth either side weren't affected and she could really just chew away freely without thinking twice. Now I'll just talk you a little bit about this lady's treatment journey. Firstly, we need to get the colour sorted. So we used Enlighten whitening treatment, whereby she had gum shields made to the specific mold of her teeth. What we did was a conventional implant placement, whereby we placed the implant or the titanium screw, and we put a healing cap on and let the gum heal around that implant site for a period of 3 months. Then we had to make her a temporary crown before we could put the final crown on. This patient had a high smile line, meaning that if she was grinning or laughing, or even, emphasizing certain words that she was saying, you would be able to not only see the top front teeth, but also see the gum line. So the temporary crown allowed us to contour that gum line to match the tooth on the other side. We did some composite edge bonding to the adjacent tooth to add some more symmetry to the smile. And when we placed the final crown on top of the implant, myself and the patient were really happy with the aesthetics and the overall result. So then I was able to secure that final crown on in that visit, gave the patient the mirror, and she was over the moon, which gives me so much happiness and joy, because I know she struggled with that denture for so long. I mean, we're on to John the Third. She can just go about her life now without always thinking, oh, I've got this denture in place, I better be careful with what I eat, how I smile, where I'm going next.